Welcome back. This is Dr. Jin Sung, where clinical excellence meets excellent results. Today we're going to talk about fatty liver, or in particular, non-alcoholic fatty liver disease. The people who do not actually drink a lot of alcohol, but they develop fatty liver. So let's get right into it. Okay. The primary cause for this is the overconsumption of sugar. Table sugar, right, or the white sugar that you see, is called sucrose. Sucrose is a disaccharide. It's made up of two sugars. One is glucose and the other one is fructose. If you see a lot of these drinks out there, or sports drinks, it has high fructose corn syrup in there, or high levels of sucrose, which breaks down to fructose. Okay? And that is causing an epidemic of fatty liver disease. Now, fructose at high levels doesn't even seem to stimulate what we call leptins. And leptins are hormones produced from adipocytes, or the fat cells in our body. Basically, when you eat, it signals leptin, and leptin will signal the brain and tells you that you're full, right? So it controls appetite and satiety, the sensation of being full, so you don't overeat, okay? So if you have a lot of fructose, sometimes you won't even know, and you keep eating and eating and eating, creating obesity, type 2 diabetes, and cardiovascular disease. They've done studies where they give just 1 week of high fructose consumption, and it shows that increases lipid production or fat production and increased lipid deposition into the liver, causing the beginning of fatty liver disease. The problem with fatty liver disease, much like hypertension, it's usually asymptomatic. You don't really realize you have a fatty liver, okay? You could have a vague symptom of fatigue with it, a dull ache in the upper right-hand quadrant, kind of around the liver, and maybe more advanced, you're going to see a little bit of jaundice, or a yellowish eye, the white of your eye or your skin. So jaundice could be a possibility, all right? So when we look at fatty liver, first of all, how do we test for it? Okay. We can do a ultrasound called FibroScan, and usually the cash prices can range anywhere from $69 to $250, or your doctor can order it through your insurance. Abdominal MRIs would pick that up in the liver, the fatty infiltration of lipids into the liver can be seen on MRI. Blood testing, like the first signs in the blood, will show a slight elevation of AST, ALT, and GGTP. And you will also see an elevation of triglyceride, even in the fasted state. So if you go in the morning, you're fasting 8 to 10 hours, and you're going to see a high level of triglyceride or fat. You also commonly will see fasting glucose be elevated, so like insulin resistance, prediabetes, diabetes. You're going to see an increase in hemoglobin A1C. You may also see increase in ferritin and serum iron, and you should also be screened for hepatitis C, okay? So those are your basic tests to determine if you have a fatty liver. Avoid high fructose corn syrup, all sodas, fruit juices, energy drinks, sports drinks, dry fruit. Dry fruit has a high concentration of sugar, and sometimes you don't know that you're getting full because you have these small things like prunes, and you're just popping prunes all day, and has high levels of sugar. Saturated fats also have been associated with high fructose corn syrup. So high levels of saturated fats from like dairy or fatty meats can also do that. But, you know, sometimes you can do a carnivore diet and still reduce fatty liver disease just by eliminating sugar. So saturated fats should be only in moderation. What do you eat? You eat more proteins and fats, especially in the morning. that kind of sets your day: extra virgin olive oil, avocados, nuts and seeds, omega-3 from cold water fish or smaller fish. Coffee and green tea actually has shown to decrease the fibrosis as well as decreasing fatty liver. In terms of diet, they've done studies on plant-based, which can be effective. Mediterranean diet can also be effective. And the ketogenic diet can also be effective. So it really depends on the individual types of patients who can tolerate a ketogenic diet versus a plant-based diet or Mediterranean diet. The most highly effective seems to be a mixture of a Mediterranean diet / heavier fat content or ketogenic diet. Okay? Exercise. You should exercise more than 150 minutes, moderate intensity of aerobic exercise per week. Okay? And you should also do some sort of resistance training 3 times a week, maybe 30 minutes a day. Supplements. NAC or NAC, alpha-lipoic acid, milk thistle, which is great for the liver. Vitamin E and vitamin D also has shown improvements with fatty liver. Omega-3s, EPA, DHA, fish oil. Curcumin, choline, spectrum of B vitamins, B as in boy, and vitamin C. Okay, so if you can do this whole regimen of reducing fatty liver, it may only take about 4 to 8 weeks to really reverse fatty liver. So it's definitely doable and it's worth a try. What I'll do is I'll link a couple of supplements that has all these different nutrients in one product rather than you trying to purchase 5 different things or 20 different things to make up what's going to help your fatty liver or liver detoxification. So I'll link that below. Fatty liver is really an epidemic. Patients need to know because it's really silent and it's impacting your overall health, and diabetes and insulin resistance is really driving this. And what's driving that insulin resistance diabetes is high fructose corn syrup, the added sugars in all the different sugary drinks as well as foods that is driving this metabolic syndrome, which is an epidemic. All right, my name is Dr. Jin Sung, where clinical excellence meets excellent results, and we'll see you guys next week on the healthy side. Have an awesome day.